education, to promote gender equality and empower women, reducing child mortality, improving maternal health, combating infectious diseases such as HIV, malaria, and other disorders, ensure environmental sustainability, and develop a global partnership for development. I will go into detail which of these have been achieved in what amount. Eradicating extreme poverty and hunger, it has declined in the 2 decades from 1990 to 2015, and in 1990, nearly half of the population in the developing world lived on less than $1.25 a day. About half of it. So this dropped to 14%. Globally, number of people living in extreme poverty has declined by more than half, falling from 1.9 billion to 836 million. Working in middle class, living on more than $4 a day has tripled. So we are talking about very small amounts of money. Even these small amounts of money make a big impact on the social determinants of health for those people living in those countries. Undernourished people, the proportion of undernourished people in the developing regions has fallen by almost half, from 23% to 12.9%. Again, this is a big number. Almost 13% of the people living in underdeveloped or developing countries is about 12-13% of those. So although there is a progress, there is a development, still it is not sufficient. Achieving universal primary education, primary school net enrollment rate in developing regions has reached 95%. This is a good figure. It was 83%. So, but still, about 57 million children in 2015 were out of school in the whole world. And in sub-Saharan Africa, primary net enrollment rate has increased from 52% to 80%. So the literacy rate has also increased globally from 83 to 91%. And the important thing, the gap between women and men has been narrowed in these times. Gender inequality. There are many more girls in schools compared to 15 or 20 or 25 years ago. In Southern Asia, only 74 girls were enrolled in primary school for every 100 boys in 1990. Today, or 6 years ago, or 7 years ago, it has increased to 103 girls for every 100 boys. Women now make up 41% of paid workers outside the agricultural sector. And women in parliament, so 90% of countries have more women in parliament compared to 1995. Child mortality is of a great concern for us as pediatricians. Under 5 mortality rate has declined by more than half, dropping from 90 to 43 deaths per 1,000 live births between 1990 and 2015. So there is a decline. There is a decrease in the number of deaths, children under 5. And also there is an increase in the vaccination. For example, measles vaccine coverage has increased to 84%. So measles vaccination helped prevent nearly 15 million or 60 million deaths between 2000 and 2013. So vaccination helps a lot. Similarly, improving maternal health helps a lot. And many of the births are attended by the skilled health personnel, which is a big impact. And global maternal mortality ratio has decreased from 380 per 100,000 live births to 210. Still, it is a big number, but there is a decrease, as a considerable decrease. Combating HIV/AIDS, malaria, and other diseases, the antiretroviral treatment, reach to antiretroviral treatment has increased. And this has averted 7.6 million deaths from AIDS between 1995 and 2013. And the new HIV infections fell by 40%. Regarding malaria, what has been provided? So we don't have an effective vaccination against malaria. One of the most important measures is mosquito tents. So insecticide-treated mosquito tents are delivered to malaria endemic countries in sub-Saharan Africa, more than 900 million. And also between those years, tuberculosis prevention, diagnosis and treatment interventions saved approximately 37 million people from death. And tuberculosis mortality rate fell by 45%. Although tuberculosis is considered a historical disease, there is an increase in many countries due to decreased rates of vaccination for tuberculosis. Environmental sustainability, as I have mentioned, clean drinking water and clean usage water is important. So 1.9, almost 2 billion people more have gained access to piped drinking water. So this is an important development for the environmental sustainability. But still, globally, 147 countries have met drinking water target. 95 countries have met sanitation target, and only 77 countries have met both targets. And developed countries have provided assistance to developing countries, and this has increased, and this increase has led to increase in the healthcare of those countries. One of the important things of global internet penetration, now as of 2015, 95% of the world's population is covered by mobile cellular signals, and mobile cellular subscriptions have increased quite a lot. So when we talk about indicators of maternal health, we mean health of women during pregnancy, childbirth, and the postpartum period. So 3 phases: pregnancy, childbirth, postpartum period. So these are the factors that we should consider for when we talk about maternal health. Major direct causes of maternal morbidity or mortality include hemorrhage, infection, high blood pressure, unsafe abortion, and obstructed labor. So as you can imagine, so all these should be carefully monitored during pregnancy, during labor, and even after labor. So healthcare personnel is important for the care of those mothers. To measure these and measure the healthcare status of women's and child health, we have some measures. One is maternal mortality ratio, which I have given examples in some of my previous slides. It is deaths of women due to pregnancy or labor per 100,000 live births. For child health, under 5 child mortality with a proportion of newborn deaths, and children under 5 who are stunted, this is percentage of children under 5 years of age whose height for weight is below -2 standard deviations. So children under 5 who are stunted, but one of the most important are under 5 child mortality and also neonatal mortality rates. The coverage indicators are, for example, need for contraception, need for antenatal care, antiretroviral prophylaxis for HIV positive pregnant women, skilled health personnel at birth, so that the birth should be attended by healthcare workers, and postnatal care for mothers and babies, exclusive breastfeeding for at least 6 months, and 3 doses of combined DPT, diphtheria, pertussis, tetanus vaccine. These are the measures that are considered as indicators of good health, and antibiotic treatment for pneumonia. So maternal health indicators are improving women's health before, during, and beyond pregnancy and across their life course, improving the quality and safety of maternity care, and improving systems of maternity care, including both clinical and public health systems. And for children, for child health, is increase the number of children who receive a developmental screening. You have heard, and probably you have also seen how it is done, Denver developmental screening tests. Another is early identification of developmental disorders, decreasing the number of hospital admissions for non-fatal injury among children 0 to 9 years of age, reducing the burden of non-fatal injury, increasing the number of children who are adequately insured. These are the aims of child health. Child mortality, these are 3 definitions. Child mortality is the probability per 1,000 live births of children who will die before reaching the age of 5. So under 5 mortality rate, in other words. Number of children who die before the age of 5 per 1,000 live births. Infant mortality is the number of children who die under the 1 year of age per 1,000 live births. And neonatal mortality rate is the number of neonatal deaths per 1,000 live births. By neonatal deaths, we consider death within the first 28 days of life. These are neonatal deaths. Beyond that is the infant, comes into the infant mortality rates. These are the definitions that you should keep in mind when reviewing the mortality ratios. So there is a wide variation of infant mortality within countries. As you might imagine, these are more developed countries, but when you go to other underdeveloped or developing countries, these are higher infant mortality rates. And these all point to different countries such as Mexico, Thailand, Brazil, China is considerably high. What are the causes of child mortality? In the first month, in we mean the much infant neonatal mortality, preterm birth complications, sepsis, intrapartum-related causes, congenital abnormalities are the most common of these, and pneumonia and tetanus follow the rest. After first month till the age of 5 years, pneumonia is a leading cause. Pneumonia, diarrhea, injuries. Malaria is still a big cause, 7% is the share. And although there is a high increase in the in vaccination rates, still measles and pertussis can cause the mortality in children under 5 years of age. So when you look at the maternal child health pyramid, you should start with the infrastructure and building services, such as needs assessment, evaluation, planning the policy, and then the population-based services such as neonatal screening in the newborn period, sudden infant death syndrome, immunizations, oral health, injury prevention, nutrition. These are all population-based services. Although you are seeing patients in the clinical context now, don't forget that these are just reflections of the population-wise disorders in the community. In addition to that, services such as transportation, outreach, health education are needed, as well as basic science, health services, services for children, etc. So this is the table that is similar to the one that I had shown you in the iron deficiency or iron anemia map, and being almost the same countries, same areas in the world that have high infant mortalities. These are showing maternal mortality rates. So the red colors are showing very high mortality rates. The green colors show low mortality rates in those countries. So as you can see, especially Africa and Southeast Asia are high for maternal mortality. Again, same problems that we had mentioned in my previous lecture. Infant mortality, again, a similar map. Again, Africa, South and Southeast Asia, parts of South America are high for infant mortality rate. Don't we have any development? We have a development from lethal infections such as malaria, diarrheal disease, lower respiratory infections, measles, and HIV/AIDS. For example, lower respiratory infections, it has decreased from 2 million to less than 1 million over over 25 years here. Similarly, diarrheal diseases has decreased. Malaria is, unfortunately, it is almost the same, because there is no big decrease in malaria. So you can search similar maps in this website, which gives very valuable information. These are interactive maps, so you can play with it, and you can see different countries, how they are developing over the course of time. There are a few examples how it has been dealt with in different countries. For example, causes and determinants of inequity in maternal and child health in Vietnam as an example. These are the factors leading to those problems. And you see almost global problems, nutritional status, distance to health facilities, childhood nutrition for educational purposes, psychosocial problems, distance to health facilities again. In Brazil is another example and you can study this table in detail. With the advance of years, there has been increase in almost all areas. So this has provided some progress in maternal and child health in those countries. Maternal or mortality rate, according to mother's education, is also greatly impacted. So mother's education greatly impacts the child deaths, child mortality rates. Here, for example, let's take an example of Niger or Mali. For example, here in the same country, the people, the children of mothers with no education have the highest mortality rate, while the children of mothers with secondary or higher education have the lowest mortality rate within the same country. Come to another country like Philippines, again, similar condition. Children of mothers with no education have highest mortality rate, and with the higher education have lowest mortality rate. So there is a direct relation between mother's education and the children's maternity rate. So what does female education affect? It affects training for the children, child spacing. It improves female health, and also female education improves nutrition and hygiene of the mothers. These all decrease to decreased infant and child mortality. Also, with the female education, there is farmer training and innovative farming, greater productivity, and all these lead to economic development in these countries. So these are what I wanted to tell about the maternal and child health related issues in this session. Any questions? Did you get anything new from this lecture?
Yes, regarding the questions we had taken, it somewhat helped us in better understanding of the topics, plus the mortality rates.
Yes, what about the mortality rates?
No, it's something new.
You hadn't heard about the mortality rates?
Yes, this is something new we have learned from you, Doctor.
Yeah, child mortality, infant mortality, neonatal mortality, and maternal mortality are the most important measures of global health problems, health status in the whole world. So when you look at a country, whether they have a good health system or not, maternal mortality, child mortality, neonatal mortality rates give a very good idea about the overall health status of those countries. So instead of looking to the patients as just patients in your office, you should see them as members of the society, members of the population. And what you see as iron deficiency, for example, is not an iron deficiency on its own. It may be a reflection of the society which is poorly iron deficient, which is poorly malnourished society. When you see a single case of thalassemia, for example, it may be a reflection of a society with a high thalassemia rate, with a high consanguinity rate, etc., etc., etc. So you should think about the bigger picture with the impacts of the society on the individual health problems. Any other questions, comments? All right. Thank you. Have a nice day.
You too, Doctor. Have a nice day.